Good evening and welcome. My name is Alain Legault and I'm the Triple P coordinator for the Sudbury and Manitoulin district. We are pleased to be part of this webinar tonight that has been organized as part of a project that is looking at the opportunities to use technology to serve families and parents in our area. Funded by the Ministry of Children and Youth Services, this project is a collaboration of many partners who provide services within our communities. We are pleased to have with us tonight Kathy, Trish, Connie, and a parent, Rebecca. They will be able to answer your questions throughout the night, okay? So if you have any questions, please send them to the beststartqa@greatersudbury.ca, or you can also do it live on your webinar screen. I think it's at the bottom left in the text box, okay? So first, let's go to our panel to find out a little bit more about Triple P and who you are. So Kathy, if you don't mind.
Hello, my name is Kathy Roy. I'm public health nurse for the Sudbury District Health Unit. So I'm going to talk a little bit today about what Triple P is. So Triple P stands for Positive Parenting Program. It's actually an Australian-based program that's been around for over 30 years, but here in our region we actually started implementing in 2009, so it's fairly new to us. What positive parenting is all about encouraging self-efficacy. Basically, that's a big word, meaning we're trying to get parents to problem solve. So we're teaching you a process that you can use in multiple situations to problem solve based on strategies that you learn. Another thing is that's what the parent learns, and what the goal is to get your child to learn is really self-sufficiency and self-regulation. That meaning, a big word to say that you want your child to be able to recognize the emotions that they're experiencing and to be able to verbalize what they're feeling. So really getting them to verbalize rather than having, for example, a tantrum. The other part about Triple P is that it's very nice is that we're really meeting parents where they're at. So if you're a parent that's just looking for general information, then we have seminars that are available, which is 3 sessions just going and getting some information. If you're looking and you're having really specific problems, then you can access one-on-one. And one-on-one allows you to work through that specific problem with a practitioner. And if you're a parent who's a little lost and doesn't know where to start and you're experiencing a lot of difficulties in your home, then we have group. And group involves parent support as well as one-on-one services as well to individualize what you've learned. So I'll pass it to Trish.
And now we're going to talk about who is Triple P for. So Triple P is for everyone. It's for all parents. It's for grandparents, foster parents. Daycare providers are using it, schools. It's a community-based program, so we want everybody on board and everybody supporting each other, and supporting parents, supporting children, and most importantly, supporting those families as a whole. As you said, there's different levels of Triple P, the one-on-one, the seminar, the group. So how can you access it? How can you find out more information about Triple P? You can contact Children's Community Network, and they will direct you to who you can get in touch with and maybe what services of Triple P that you require at that time. That's the access point. And and you could call a Best Start Hub. They may have some information and they can direct you where to go as well. Yeah.
Thank you, Trish.
You're
Connie?
welcome.
Hi, I'm Connie Cascanet, and I'm with Child and Family Center. And the 2 different areas that I'm going to present are, number 1 is the clinical area, which is based on the Triple P Enhanced program. The Enhanced program is what we classify as a clinical program because, like what Trish just explained, you have to go through CCN as central access to do an intake to get assigned to our agency at Child and Family Center and be assigned a clinician. The clinical programs are offered one-on-one, and then we also have the Triple P Indigenous program. And with the Indigenous program, Similar to what Kathy was already discussing, the program was designed in Australia for the Aborigine people, and okay, thank you. Okay, but the program works very effectively as well with our Aboriginal people here in Northern Ontario. So whether you're Ojibwe, whether you're Odawa, Potawatomi, Cree, Mohawk, the program still works very effectively. And it is a cultural program because it enhances the Triple P group level, but also with our cultural teachings. It is a very effective program, and our parents thoroughly enjoy the program because it's a little bit slower pace, more friendship based, and a lot of teachings around respect. So, thank you.
Thank you very much, Connie, and thank you to the panel. And before we continue on, please feel free to send in your questions via the webinar or at beststartqa@greatersudbury.ca. Just want to make sure that's clear. Okay, so we'll start with the first question. Trish, if you don't mind answering this question. My child, who's 3 years old, is displaying challenging behaviors at home, such as whining to get his needs met and biting for attention. He has learned these behaviors from his daycare, as the educator has mentioned that he seems to be copying a peer from his group. How can I deal with these inappropriate behaviors so that he does not do this at home or at daycare?
Okay, so these are pretty normal things that parents go through. First of all, there's two different problems here, right? We have the whining and we have a child who's biting. So I'm going to start with the fact that the daycare provider is a wonderful resource and a great way to, they would be a great support. So if you want to start there and talking to the educator, because the educator is seeing that, it's happening at daycare, they're copying some behaviors and learning some new behaviors that, that we want to try and work with. So, first talk to that educator and work together. And what I can suggest for the whining part of it is, especially at 3 years old, right, you can have a conversation with your child that when they're whining, that you're not going to give them what they want, that you want them to use their regular voice, right? And when they are not doing that and they are whining, we can certainly just ignore that behavior. And use our body language to maybe, turn around, not make eye contact with that child so that we're not rewarding them for that whining. And then for the biting, that's a little more severe, right? We don't want our children hurting anybody. And so biting or hitting any behaviors like that, that's when we would discuss timeout. And timeout is quite a process, and I know we may be talking about it a little more later. So yeah, those are definitely some things that we can do for those two behaviors. Pretty common, pretty normal behaviors that I think we all go through having preschoolers at home.
Thank you, Trish.
You're welcome.
Any questions from the audience? Okay, we'll carry on. And don't forget to send in your questions to beststartqa@greatersudbury.ca or on your text on the webinar under your picture there. Connie, what is acceptable behavior?
Well, okay, let's define acceptable. Some people think of acceptable as being normal, but when we really try to define what normal is, we could be here all night. So when we're looking at what's acceptable it's to what the parent says, okay? If it's working in your home, if it's positive, if it has good effects, it's acceptable. If it's not working and it has some kind of negative effects, then it's definitely not acceptable. So we try and keep those things very simple, and for different families, it's different levels.